Good afternoon, everyone. My name is Carol Golly, and the title of my presentation today is Coping with the Emptiness, Tips for Targeted Grandparents. And I'd like to start by thanking Elaine Cobb and the Family Access team for inviting me to participate in the conference today. I'd like to just start by giving you a little idea of what I'll be covering today and topics for the presentation. So it is a particularly devastating and harmful phenomenon of grandparent cutoff that appears to be affecting an increasing portion of people. So I wanted to start with a little bit of information about what grandparent cutoff is and facts about grandparents and disruption of the grandparent-grandchild bond, because it's hard to talk about coping without at least talking somewhat about the phenomenon of grandparent cutoff, because it's just been very recently written about, and we're learning more about it. And so there right now is not a great deal of information yet about the specific nature of grandparent cutoff. And then I'll spend the most of our time today talking about coping with grandparent cutoff, which is a very devastating phenomenon for grandparents and families and grandchildren. So first of all, a little information about grandparents today. There are 70 million in the US, which is about 1/3 of the United States population. And human life expectancy has increased threefold in the past 200 years, leading to many more grandparents and great-parents being available for intergenerational family relationships. And so that with the population increase has become an increase in grandparents, of course. And the grandparenting role is very vital for many grandparents. Most grandparents, 72% of grandparents report that being a grandparent is the single most important and satisfying thing in their lives. So what is grandparent cutoff? Grandparent cutoff is a phenomenon in which a grandparent is denied contact with his or her grandchild or grandchildren. The term could also apply to instances in which the grandparents are not told they have grandchildren, or the relationships are never established, disrupted, or cut off. Currently, there's a minimal understanding of and support for cutoff grandparents because, as I had said earlier, there's really a lack of research and studies and information about grandparent cutoff. So as a therapist in private practice in Florida for many years with children and families, I saw what seemed to be more and more families affected by issues of cutoff, alienation, and estrangement. And Florida is the grandparent state. So there are many grandparents there and who share stories about being cut off from grandchildren and being estranged from adult children. And so I heard these stories both professionally and personally, but I wanted to learn more about it, but I was unable to locate many articles or information about such a phenomenon. It seems so unnatural, having grown up with, I've been close to grandparents myself, and in my generation. I don't think it was something that we had really heard about a lot, that grandparents were cut off from grandchildren. And I could only find about a half a dozen articles on the issue, so I decided to look into the phenomenon as a research topic for my recent doctorate in social work. So there are 2 to 3 slides in my presentation today from my dissertation study. And if anyone's interested, my full doctoral paper is available on the Family Access website, if anyone would like it. The title of it is Grandparents Who Were Cut Off from Grandchildren, an Exploratory Study. So how do grandparents get there? What are the potential pathways to cutoff? It just, as I said, it just seems to be a hard thing to understand. So I asked that question in my doctoral research, and 43% of almost 300 respondents indicated they were cut off when their adult child was cut off. From their own children. In other words, the grandparents were cut off along with their adult child when the adult child was actively alienated from their children by a current or former partner or spouse. This is consistent with parental alienation, which we'll talk more about. And then almost a third of surveyed grandparents reported being cut off when their adult child died. And one grandparent in this situation had shared with me a quote, "Not only did I lose my son, but both of my grandchildren also. My daughter-in-law cut ties, moved away, remarried, and has refused to let us see or talk to our grandchildren for over 9 years. In some cases, the new spouse may formally adopt the children." Other pathways identified in the literature to cut off include incarceration of the grandparent's adult child, a geographical move occurring between grandchild and grandparent, or when the grandparent has behaved in an inappropriate or harmful manner toward the adult child and or the grandchildren. Also, poverty and lack of resources might result in challenges regarding grandparent contact. The early research on grandparent cutoff showed that geographical distance could be quite problematic for maintaining grandparent-grandchild relationships. But in my study, it didn't appear to be as big of an issue, and I think it's because of the social media and computers now. Okay, so a little bit about parental alienation was first identified by Richard Gardner, a clinical professor of psychiatry at Columbia College of Physicians and Surgeons, New York. Parental alienation is defined as a condition in which a child, usually seen in high conflict divorce situations, allies strongly with one preferred parent and rejects the other alienated or targeted parent without justification. One of the 8 manifestations of parental alienation is a child, unfortunately, is a spread of animosity to the extended family of the alienated family, of the alienated parent. So in other words, the alienated parents, their aunts and uncles, siblings, that entire side of the family is often cut off in parental alienation. And so in that way, grandparents become collateral damage as in their grandchild relationship with their grandchild, as their adult child becomes alienated from his or her own child or children. And this is this phenomenon has been replicated in other cultures throughout the world. So who did grandparents see as most responsible for them being cut off from their grandchildren? And that was something that I included in my survey of the grandparents. So almost 3/4 of the grandparents found that the daughter or daughter-in-law was most responsible for the cutoff. And this is reflective of the prior literature and studies. Another compelling finding is that daughters and daughters-in-law were perceived to be responsible for nearly 3/4 of grandparent cutoff. These results appear to reflect researcher Edward Crook, from a psychologist in Canada, his concerns in which significant numbers of fathers, and by default the father's parents, find themselves at risk of paternal alienation and absence from their children's lives. This is father absence, is called paternal alienation by Dr. Crook. Other researchers investigating grandparent involvement after a divorce in the middle generation found that grandchild relationships with maternal grandparents were often strengthened because mothers received primary parenting, or what we used to call primary custody, whereas the paternal grandparents' relationships with their children were often weakened. So that's a real concern to have so many fathers affected by parental alienation. But it can go either way, and I know that now there are studies that shows it's alienating parents are just as apt to be women, mothers, as they are men. So what are consequences for grandparents who become cut off from their grandchildren? How does that affect them? This was really what I wanted to study, because the effects seem so serious. So grief, which is defined as deep sorrow, a natural reaction to loss on many levels. Grief is both a universal and a personal experience. Individual experiences of grief vary and are influenced by the nature of the loss. Some examples of loss include the death of a loved one, the ending of an important relationship, job loss, loss through theft, or the loss of independence through disability. Other consequences from grandparents could be fear of never seeing their grandchildren or extended family again, and fear of the unknown, worry regarding safety and well-being of their grandchildren and extended family, and worry about self-identity. Who am I now if I don't see my grandchildren? Am I still a grandparent? Also, sadness at being shut out of family gatherings and events, and inability to pass on family history, culture, and traditions, which is really such an important part of being a grandparent, is sharing the wisdom and the family culture, and letting the grandchild know that this is how our family operates and this is who we are, and giving them a sense of intergenerational wisdom and knowledge. Other researchers have reported a range of negative consequences for grandparents experiencing sudden loss of a grandchild, including intense chronic grief, symptoms of post-traumatic stress disorder, cognitive intrusion, which means that the thinking of the grandchild kind of pops up frequently for the grandparent many times a day, the memories and thoughts of the grandchild. Also, mental health problems, lowered life satisfaction, numbness, shock, and denial. Also, shame and rejection, betrayal, and depression can also be consequences. In a subsequent publication, kind of the original researchers that I found on grandparent cutoff were Drew and Silverstein in 2007, found that mental health progressively worsened for these grandparents as they grew older, and that affected grandparents were at possible risk of suicide. They suggested that grandparents may develop innate resiliency and resources for coping skills over time. And that may be assisted through grief therapy. So in my study, my dissertation study, I wanted to see the relationship of grandparent to physical and mental health. So according to the Center for Disease Control, the majority of older adults do not suffer from depression, and estimate that depression for older adults 65 and older ranges from 1 to 2%. But yet, I found that 46% of grandparents who reported complete cutoff from grandchildren reported moderate to severe levels of depression. 29% were at risk for suicidal behaviors. In 2007, again, Drew stated that grandparents in such situations could be at risk of suicide, but there is no previous data available on alienated grandparents and suicide. But the norm for seniors in the United States for having suicidal behaviors is only 2 to 3%. So this is very concerning. 29% reported by my study population, and 12.8% met criteria for complicated grief, and the norm for seniors is only 4 to 5%. So one grandparent researcher named Kivnick in 1982 wrote, "Grandparenthood does have a real connection to the lives, morale, and the mental health of grandparents." So does grandparent cutoff have an effect on health? Certainly there appears to be a connection. Grandparent alienation may be an invisible because no one sees the anxiety or broken heart, although the physical consequences become apparent. So we could consider this stress-related illness, likely, and it may be the root cause of physical challenges such as migraine headaches, high blood pressure, gastrointestinal problems, which is where we tend to release our anxiety, is in our gut and our digestive system often. Sleep disorder, obesity, could be overeating or undereating. Acute anxiety, post-traumatic stress disorder, and depression. So the mourning experience of estranged grandparents may indicate the presence of complicated grief. Complicated grief occurs in 2 to 7% of bereaved individuals following the death of a loved one, or in a major loss, and is defined as a persistent yearning for the lost object, feelings of shock and emotional numbing, a sense of being alone in the company of others, and a belief that life is meaningless as a result of the loss. Complicated grief includes symptoms that are analogous to post-traumatic stress disorder and leads to the same level of emotional and physiological distress that accompanied the original loss. The longer that someone struggles with complicated grief, the more likely he or she is to develop significant mental health problems, according to researchers, most notably major depression and anxiety. According to Ferguson and Jacobs, complicated grief symptoms that are elevated and persist for 6 months can be associated with health risks such as cancer, cardiac events, increased substance use, and suicidal ideation. Unlike what we consider more normal grief, complicated grief symptoms are resistant to the passage of time into treatment with many antidepressants, which can be helpful in ameliorating normal bereavement-related depression. So complicated grief is more resistant to treatment. The authors also found that increased levels of complicated grief symptomology in particular are associated with a greater likelihood of suicidal ideation. So complicated grief appears to present a very serious threat to emotional and physical health and well-being of grandparents that are affected by complicated grief. So grieving a death or loss is a part of human experiences and also is seen in other species. I know that we've heard about elephants that stay with their herd members who have died for great periods of time, sometimes for years. And other species also we know exhibit grief. So complicated grief was identified as a persistent, debilitating, life-altering type of grief that does not follow the normal pattern of improvement. Prevalence of complicated grief in the general population is 4%, yet almost 13% of cut-off grandparents in my study reported complicated grief. By 2018, complicated grief criteria was reworked and named prolonged grief disorder by the World Health Organization. And the American Psychiatric Association followed in 2020 with a slightly different version. The American Psychological Association, or APA, criteria for the disorder are above, and this is from the Diagnostic and Statistical Manual, or DSM-5. So the prolonged grief disorder is persistent yearning and longing for the lost object, disbelief, intense emotional pain, identity confusion, who am I now, avoidance of reminders of the loss. That can be a trigger for the grief, numbness, intense loneliness, meaninglessness, and difficulty engaging in ongoing life. So Catherine Shear is a physician at Columbia College for Physicians and Surgeons. She's written many articles and provided a lot of information about complicated grief and stress on her Center for Complicated Grief website. Keep in mind there is no specific therapy known at this time to specifically target cut-off grandparents. However, it may make sense to target grandparents suffering overwhelming feelings of loss and grief to receive support specifically targeting families of feelings of grief and loss. Complicated grief therapy is similar to psychotherapy techniques used for depression and PTSD, but it's specifically for complicated grief. It involves a 16-week therapy session, and I believe these are available online. They explore such topics as understanding and accepting grief, managing and monitoring symptoms, thinking about the future, reconnecting with others, telling the lost story, learning to live with reminders, and connecting with memories. This treatment has been found to show greater response rates and faster response times compared to interpersonal psychotherapy for complicated grief disorder. A slightly different way to conceptualize grandparent cutoff loss is called ambiguous grief. This is a picture of Pauline Boss. She is a professor emeritus at the University of Minnesota who introduced the term ambiguous loss in her 1990 book and has written and studied the term throughout her life. Ambiguous loss refers to a type of loss that occurs when a loved one is either physically present but psychologically absent, or physically absent but psychologically present. Early in her life, she studied families of missing POWs in order to conceptualize and understand the experience of people suffering such losses. These are some basic ideas of ambiguous loss ideology and thinking. Ambiguous loss, a loss that is ongoing, so there is no closure or finality. And Dr. Boss said that closure is a great word for real estate, but it's not a good word for loss because it's now known or thought about grief that we really never get to closure. It's more learning to live with the loss and coming to accept it, but not being expected to ever have full closure and move forward, because that loss will always be a part of our life, although we may get to a point where it's not so devastating to think of the loss and to cope with it. So, and there's also no verification of loss because the person is still present. The loss is complicated because it is ambiguous, not because of the characteristic of the griever. There can be no ongoing sadness and grief there can be ongoing sadness and grief without pathology. So what Dr. Boss says is that there's nothing wrong with somebody for grieving a loss for many, many years when it's an ambiguous loss, when the person is gone from our lives but still alive, it's so difficult to reconcile that it may go on for many, many years. And that's not anything that doesn't speak to any pathology of the person grieving, but it speaks to the type of loss. So this is what Dr. Boss had said to survivors of 9/11. What you're experiencing is ambiguous loss because your loved ones are still missing. It's the most difficult, most stressful loss there is, but it is not your fault. And we know that in grief situations, we tend to blame ourselves. And so it's important to remember, particularly with grandparent cutoff, that these are things we generally have no control over, being cut off as a grandparent. So it's important to realize that the ambiguous nature of this loss is very hard to cope with. One of the most stressful losses there is, but it's not your fault. Cut-off grandparents likely experience ambiguous loss in which the grandchild is not physically present, yet is present in the heart and mind of the grandparent. There's continued hope for reunification, which results in ongoing stress for the grandparent and makes it difficult to reach acceptance of such a painful loss. Grandparents yearn for a reunion with their grandchild, and their continued hope makes it difficult to move on with their lives and regain a sense of mastery in life. Lack of social support, wrote Boss in studying the families of missing World Trade Center workers. Citizens asked, why aren't they over it yet? Yet there seemed to be little empathy for families of the missing who need more time to grieve. It's if the public doesn't realize these types of losses take more time to grieve when there is no body to bury. there's no sense of, we don't know if this person died. There is a lack, with ambiguous loss, there is a lack of ritual, memorials, ability to visit a place of meaning and referencing the loss. So she said this could be called disenfranchised grief. It's a loss that cannot be openly acknowledged, publicly mourned, or socially supported. Alienated grandparents are often fearful of telling anybody about the alienation for fear that that information will get back to their alienating adult child, who may increase the intensity of alienating behaviors, or say, I've heard some grandparents say, well, they told me when they found out that I was, working so hard to, when I was talking about the loss to other people, that my adult child became very angry and said, that's it, you're not going to see your grandparent anytime soon. So there's a lot of fear of being able to talk about it. So there's probably a great deal of isolation and shame and guilt, which makes this loss harder. So cut-off grandparents are likely a group that suffers in fear and silence. Effects of ambiguous loss, immobilization, relational conflicts, and physical and emotional issues. Grief is frozen and coping can be blocked. And as we know from talking about grief earlier, the depression, anxiety, trauma, guilt, substance abuse can be coping mechanisms that are neither, some are, as we'll talk about in a minute, are helpful, and some are not, but the effects of grief and loss are very serious. So Pauline Boss has a quote that I think is really appropriate for cut-off grandparents. Living with someone who is both here and gone, or gone and not for sure, is a bizarre human experience that produces confusion, doubt, and anxiety. So, guidelines for resilience with ambiguous loss. Finding meaning. What does this situation mean to you? Is it a lifelong test of your strength? Is it a punishment? How you cope with it in your life depends what it means to you, and nobody else can tell you what that means to you. It's very individual, and it's important to really think about that meaning, because that's how you can work on coping. It's how other people can, if you do choose counseling or help or a support group, it's how other people can be aware of what meaning that loss holds for you. To communicate and share that in itself can be, and to name it can be healing. Letting go of what you cannot control. Defining who you are now has that changed? You are still a grandparent, but your involvement with your grandchild may be different. Normalizing ambivalence, revising attachment. Pain of loss comes from loss of close relationships. How do I both let go and still remember? Grieving who is lost while celebrating what remains, and discovering hope. How do I find hope in an ongoing loss that has no closure? Boss says one of the best ways to do this is to practice both /and thinking, or holding to opposing thoughts at the same time. Boss says this is the only way that we really respect what is true and known about the cutoff situation. And an example of this is saying, on the one hand, my grandchildren may come back to me, but maybe not. I am both sad about seeing my grandchild and joyful about other parts of my life. And she says, now and then there are problems that don't have a perfect fix. And then this idea of holding to opposing ideas in your mind at the same time is very useful for stress reduction. It's more of an Eastern way of looking at life. And it can be harder, I think, for Americans to kind of wrap our head around being okay with having two opposing thoughts at once. Because we want to fix, we want to know what we can do to really move forward. But this has been shown to be helpful in some of her research studies, very helpful to people that are suffering from ambiguous loss. So I've got information on a resource list about these grief experts that I'll share. But I wanted to move in a little bit to stress and the effect of stress for cutoff grandparents. And first of all, a little bit about stress. It's a key survival mechanism that develops in our bodies in response to real or imagined threats. It's our body's way of reacting to the good and the bad. Stress can stem from an event, thought, or experience that makes you feel frustrated, angry, anxious, or overwhelmed. It's often a feeling of physical tension in your body. While we often try to avoid it, stress is a normal, healthy part of life, and the human body is designed to experience and effectively respond to stress. But susceptibility to stress from person to person varies, and there are many different factors that contribute to stress. Stress can be acute or chronic. Chronic stress is ongoing stress that wears you down over the years. It arises from serious life problems that may be fundamentally beyond our control. Poverty, war, racism, family rejection, things such as this. So what are the effects on the body? It's a graphic to briefly show that. With short-term stress, the body signals the release of adrenaline, which prepares the body for fight or flight. This is adaptation in times of danger. With long-term stress, however, a hormone called ACTH plays an important role in stimulating the production of cortisol. While producing cortisol is a necessity for life and helps keep us motivated, awake, and responsive, too much cortisol can become dangerous and contribute to lifelong problems. So long-term use of corticosteroids or chronic stress are two of the biggest contributors to high cortisol levels. And how are ways that we can manage stress? Because we know that the long-term effects of it have serious physical complications, high blood pressure being one, heart troubles, and gastrointestinal issues. We know that 43% of all adults suffer adverse health effects from stress. 75 to 90% of all doctors' visits may be for stress-related ailments and complaints. It's technically a physiological response, but it as much emotional as it is physical. Long-term sustained levels of stress can actually make us physically ill. Unhelpful ways to manage stress are reliance on tobacco, alcohol, constant worrying, ruminating out loud, talking to other people about stress constantly without different types of input and focus, and then impulsive or high-risk behavior. What about helpful ways to manage stress? what could we do differently? What could maybe you do differently that would help you cope with being cut off as grandparents? Switching, one really important thing is switching to a whole foods, anti-inflammatory diet. Maybe you already do that, practice that. There's a lot more information available about this currently. But poorly managed blood sugar levels, especially hypoglycemia, having low blood sugar, and high levels of inflammation can contribute to high cortisol levels, which as we know, is the stress hormone, chronic stress hormone, and other hormonal imbalances. But following an anti-inflammatory diet, low in processed foods and high in antioxidants, fiber, and essential nutrients is key. Include healthy fats and proteins with every meal. Proteins really can help steady our blood sugar and prevent kind of those highs and lows from being very hungry, very, that can make us feel jittery, anxious, or angry. Make sure to get enough fiber and phytonutrients by eating plenty of fresh fruits and vegetables. Some of the most useful foods for lowering cortisol and stabilizing blood sugar include vegetables, fruits, coconut or olive oil, nuts, seeds, and lean proteins like eggs, fish, and grass-fed beef, and probiotic foods like yogurts and cultured vegetables. Exercising regularly is really helpful. It's hard to do when you're feeling down and depressed. It's really hard to get up, sometimes even out of bed. But exercise is one of the most important things we can do to cope with stress and to improve our sense of well-being and self-esteem. According to Harvard Medical School, regular exercise of 30 to 60 minutes most days of the week, depending on the intensity, is one of the best ways to manage stress, balance hormones, sleep better, and aid normal metabolic function. The key is to not do overtraining and overexerting yourself, which can actually cause more cortisol to be released. But they say 30 to 60 minutes of sustained walking, swimming, bike riding, some kind of canoeing, whatever it is that you enjoy. Exercise benefits hormone levels because it generally helps bring cortisol back down to normal levels afterwards, kind of that good feeling we get after a nice walk. Also, sunlight is very important. There's a lot of information about sunlight being an antidepressant and helping us feel calmer. So, let's see, essential oils are basically plant extracts. They're made by steaming or pressing various parts of a plant to capture the compounds that produce fragrance. It can take several pounds of a plant to produce a single bottle of essential oil. The quality of essential oils on the market varies greatly from pure essential oils to those diluted with less expensive ingredients. Because they're not regulated, the label may not even list everything in the bottle you're buying. That's why essential oils should not be ingested. Some studies suggest essential oils are helpful for fighting stress and balancing hormones. Essential oils, including lavender, myrrh, frankincense, and bergamot, contain potent active ingredients that have been shown to naturally lower cortisol, reduce inflammation, improve immunity, and help with sleep and digestive functions. The use of essential oils for healing has existed for thousands of years and is called aromatherapy. The safest way to use them is by aromatherapy accessories such as necklaces and bracelets made with absorbent materials that you can sniff throughout the day, or through the use of body oil, which have lavender and other essential oils contained within the oil, which is usually olive, jojoba, or coconut oil. Spending time outdoors is very important in nature. Physical settings play a role in stress reduction, and being in nature is a well-documented way to promote relaxation. Try going for walks or runs, especially being barefoot. It's a practice called earthing, feeling the sand on your feet, spending time at the ocean, walking through forests, gardening at home, or doing other things outdoors and away from technology to reduce anxiety. Also learning what your stress triggers are, making time to unwind and ride the wave of strong emotions, and diaphragmatic breathing is an easy technique to learn on your own and practice throughout the day to relieve muscle tension and anxiety. Such breathing techniques have been a staple in Eastern health practices for centuries and are becoming more popular in the West. A book, thanks to emerging studies and books describing their benefits, such as Dr. Benson's book, The Relaxation Response. The basic mechanics of controlled breathing differ a bit, depending on who is describing them, but they usually include three parts. Inhaling deeply through the nose for a count of 5, making sure the abdomen expands, holding the breath for a moment, and exhaling completely through the mouth for a longer count. Keeping a journal where you write down things you are grateful for can be very helpful, or just writing down your thoughts and feelings. Sharing how your feelings, how your perceptions change through time can be very helpful too. Practicing self-care. Focus on what you can control. Modify your definition of a good day. Maybe a good day is just taking a walk, even if it's to the mailbox and back, and getting some sunlight and saying, that's a good day for me. Shift negative self-statements to statements that allow you to function with less distress. Shift, this is a terrible time for me this is a terrible time, and I am gaining strength to get through it. Or I am doing what I can to survive this. Let go of shame and guilt, and problem solve and set achievable goals, even if they're just very small goals for one day, to set those and tell someone about them if you're concerned that you won't follow through. To help you with accountability, call a friend, let them know that you're going to work on that day. So coping with cutoff, grandparents cannot heal from their loss without first hurting. As the panic stage passes into despair, the struggle for emotional survival continues. So grandparents vary in the amount of emotional resilience they can muster. Be kinder and gentler to yourself. Step back and give value to the relationships that you do have. One thing is planning for anniversaries, birthdays, dates when losses occurred. To define for yourself what meaning these losses have, for these anniversary dates have in relation to the losses, and deciding what would be important for you to do on that date. Maybe it's just thinking about your person. Maybe it would be a yearly remembrance or ritual, or lighting a candle. Like you can decide what's important to you. Rituals can be very healing and helpful in our lives. And with ambiguous loss, it's harder. We have to be creative about how we're going to recognize the losses that we're coping with. If you feel the need, seek counseling, but try to be sure that that counselor is aware of complicated grief and ambiguous grief and grandparent cutoff, because as we know from the parental alienation world, many counselors are not trained or knowledgeable of such family phenomenons and situations, and can make can make the problem worse for the grandparent. And support groups can be very, very helpful. 42% of grandparents in my study found support groups somewhat helpful, and 36 found them extremely helpful because they can normalize your feelings and have shared experiences. There's less isolation, guilt, and shame. And practicing good sleep habits. I'm running out of time a little bit, so I will share my PowerPoint if you'd like to read about this in a little more depth. But sleep is really critical. It's very hard when you're hurting, but it helps us survive. We have to have good sleep to survive, and especially to cope with challenging life situations. Mindfulness is also a very powerful way to cope with cutoff. It's the practice of becoming more fully aware in the moment and non-judgmental, and involves a heightened awareness of sensory input. How is my body feeling? What am I perceiving at the moment? There is no necessary religious component to mindfulness. Anyone with any belief system can benefit from mindfulness. And these are the benefits from mindfulness. Increased tolerance and modulation of emotion, and stress reduction are probably two of the biggest ones for cutoff grandparents. But there are many benefits to mindfulness for us, even if we just engage in a little bit of meditation for 30 minutes a day, either through prayer or meditation, and other types of mindfulness activities, maybe such as yoga or other centering activities. Okay. Practice on slowing down and enjoying the things you can experience. Just shifting gears real quickly for a moment, because suicidal thinking is such a concern for cutoff grandparents. If you're thinking about suicide, talk to someone you trust. Call 911 or your local emergency room. I do have the number here for the National Suicide Prevention Hotline. Several grandparents in my study told me, although they were suicidal in the early months or years following cutoff, those feelings shifted and they were able to live a meaningful life regardless of the pain and move on to engage in resiliency and move through the grief and the suicidal thinking. So never lose hope. These are other interventions for grandparents that I know have been covered before in some of the presentations through Family Access, but reunification, legislation for grandparents' rights, and court mediation. I know of 300 cases of reunification with the grandparent and the adult child and grandchildren, so there is always hope. I have listed on my list of resources here, this is my last slide, information about the Complicated Grief Center, the Ambiguous Loss Center, the Mindfulness Center at Brown University, and Family Access has wonderful help on Family Access, the Elaine Club's website. Much information from experts in the fields of family estrangement and alienation, and also on Alienated Grandparents Anonymous website, which I have listed. There on both websites, there are lists of support groups throughout the United States and in other countries, as well as resources available and a lot of information for cutoff grandparents. Thank you so much. I'm so happy to be with you today, and look forward to being with my colleagues to take some questions soon. Thank you.